Dr. Levinson, your status as a VA whistleblower has been at the center of your campaign, and at the same time, some of the problems that have been reported at the VA are reported to have started well before those issues came to light publicly. I'm just curious if you could talk a little bit about why you didn't come forward publicly earlier.
Well, as long as I was able to do my job with integrity, I worked within the system. That's how we were all trained. That's what we tried to do. But when the VA changed how they would deal with problems from addressing them to covering them up, that's where I got off. That's when I met with Ann Custer, and I will say, if Ann Custer had done her job, I wouldn't be running here tonight. I met with her. The first words out of her mouth was the VA wasn't in her congressional district. Never mind all those veterans from her district that do use the VA. Never mind, she's the ranking Democrat on the VA Oversight Committee. After she became bored with us, bringing our complaints to her, she next said, I have to go now. I'm going to a fundraiser. If you want to have this conversation, you can go there with me. And on the table in front of us was a form to donate a large dollar amount. She is shaking down her constituents rather than dealing with problems. And as soon as I was unable to deal within the system, I became a whistleblower. And whistleblowers have a hard time. Rarely do they work in their profession again. So this was something that needed to be addressed.
And Ms. Blankenbecker, you have decades of experience working in the healthcare field as a nurse, as an administrator in the military. What specific parts of the Vision 2025 strategic plan for the VA in New Hampshire do you see being implemented as a priority within the next 6 months?
Well, certainly, I think that our veterans having a choice of where they want to go for care should be a priority. You know, as you stated, I cared for our wounded warriors on the battlefield over in Afghanistan, and the care for them doesn't stop. That goes on in perpetuity. These people, you know, we promised them care for life, and we owe them care for life, and so they deserve the best care that we can give. You know, they certainly shouldn't get be treated as second-class citizens and get second-rate care. Now, some people really like to go to the VA, and so we want to keep the VA system going for those folks who like to be treated by folks within the VA system. But we also know as a healthcare provider that outcomes are better for people when they're close to their families. And so if they're close to their families, where those specialists are, where they can get that good quality care in their own community, we need to let them go there. So certainly veteran choice.
Mr. Boulogne.
I have two brothers in Vietnam era veterans, and one of them lives on Hospital Road in Colbert, short walk from the hospital. And when he needs medical care, he has to drive all the way to White River Junction and back. It's a 6-7 hour round trip. And I am not disparaging the hospital in White River Junction. He says he got good care there. But if you just gave all the veterans a card that said they'd get the medical care, then they deserve it. I mean, when you put your life on the line for the country, you deserve the best medical care that the country can give you. Just give them a card, a medical card, where they can go wherever they want. And allow the Veterans Administration hospitals to compete with the other hospitals. I don't want to shut any of them down, but if they're really that good, let them compete with private hospitals. And you know, it would. I'm sure that my brother is not the only one with that type of problem.
Mr. Belanger.
Well, the problem, I mean, I believe that veterans should be able to go to any hospital to get their care so that they can get their issues taken care of. But the problem we have is we have a terrible lobbying system in this country, and our lobbyists are crooks. They make a lot of money, and they turn around and they make it hard for an individual to get health care. They make it hard for a veteran to go get care, even in their own VA, because we have just so many lobbyists in the pockets of our Congress and Senate that it's terrible. We need to fix the lobbying system so we can start getting down to making our hospitals doing things on a fair playing field. And I think once we start working on that, everything else is going to fall in line. And we need to also make sure that people understand, these contractors, that just because you're doing work for the federal government, it doesn't mean that the cost can be astronomical. It needs to be fair.
Mr. Burns.
Government health care has failed. Government fails at delivering health care. I support fully funding Veterans Choice and then leaving the VA to deal with wartime wounds, such like burns, massive head traumas, and bionics like we see Dean Kamen producing here in Manchester. And this would help streamline everything. The VA has absolutely failed. There's a recent study out since we've made some changes at the VA. Infections are up. Customer dissatisfaction is up, and employee dissatisfaction is up. The government cannot handle health care. Full veterans choice. They have a card. They can go to any hospital they want, and the VA will continue to localize and treat war-type wounds.
Mr. Negron.
Thank you. And Casey, that's a great question. And it was central to Dr. Levinson's campaign. I think that the thing that I'm trying to wrap my head around is that in looking at Facebook, because that's what we do, Dr. Levinson put out that the very #1 reason to vote for him into Congress is that he took on Washington and won. I don't think anybody's won. You know, if you look at the Secretary of the VA, just in the end of July, we have 400,000 backlogs that's going out there. This fight's not over. And the people that have been fighting it long before Dr. Levinson became a whistleblower were veterans and veterans organizations. And those are the ones that are out there that have started turning this tide. You know, we the ones that are veterans, and we're veterans on this stage, you know, we're the ones on the outside trying to get in. It's not the people on the inside. So we need to take our hats off to all those veterans that are out there trying to make this right. And that's what we should do. You know, the president signed the Mission Act, which is allowing choices for any vet to go to anywhere. Those are the things that we need to do, and I think that's what we need to continue.
Mr. Levinson, you have 30 seconds.
Yes. When Secretary Shulkin got notice of what we were doing as whistleblowers, he came with $30 million in new funding. He removed some bad leadership. Measures in New Hampshire went up. They're still improving. Clearly, a lot more needs to be done. The problem is Ann Custer. She would not help New Hampshire. I went to her saying we have to spend this money wisely, and her response was California is next up for any new building projects. We need a representative that will represent New Hampshire and not California.